Asthma is a chronic lung disease. What I mean by chronic is that it's something that will be with you for a long time, usually all of your life. It's a condition that is often genetic, but at its heart what it does is it causes inflammation and narrowing in the airways of the lungs, in those tubes, that will then cause the symptoms of wheezing, coughing and shortness of breath. There are lots of different causes of asthma. Asthma tends to run in families, so if you've got someone close to you who either has asthma, eczema, hay fever or allergies, then you are more likely to be diagnosed with asthma if you have any symptoms that might relate to it. But once you've been diagnosed with asthma, then there are a few things that might trigger your symptoms. Those include things like dust, pollens, or animal hairs that people might be allergic to. You might get asthma symptoms more in the winter because cold air can trigger your asthma as well. If you're exercising, you might find that you get more wheezy or short of breath, and things like smoking and pollution can also trigger an attack. If you've got a cold, flu or chest infection, that will mean that it's harder for you to breathe if you're asthmatic, and you might need extra medication. So the difference between signs and symptoms is that the signs are what the doctors would see and the symptoms are what the patient experiences. So what the patient will experience with asthma is wheezing, coughing, tightness in the chest or shortness of breath, especially either on exertion or maybe at night. But you also might experience more symptoms when you have a chest infection or a cough or a cold.